This is FYI on Your TV, brought to you by Hometown News. I'm Kathy Botham, and I've got Andreas Seelisch with me again. You're the Director of Audiology at Hearing Solutions. Welcome back to FYI.
Hi, Kathy. Thanks so much for having me back.
Let's talk a little bit about what your position as a Director of Audiology is.
So we're the largest independent hearing aid dispensary in Ontario, and so my role is looking after our clinical team, making sure that we're upholding the highest clinical standards we possibly can. Our philosophy is that you can give people the best level of customer service and combine that with good evidence-based practice, people get the best results, and that's really what we're aiming to do. Help people hear better and live the quality of life to the best of their ability.
And I mean, we're going through this pandemic right now, and they want people to wear masks, and people with a hearing disability, I know they struggle with wearing a mask, well, not wearing the mask physically, but being able to lip read and be able to get your body, your facial expressions and everything like that. So that's what we're going to talk a little bit about today, is how to support somebody, how to communicate with somebody that has a hearing disability, and you're wearing a mask.
Great, and there's three major contributing factors to why that's happening, and I think it's a helpful starting point to help people to understand what's actually going on. And so the first might be obvious to some, but the mask wearing muffles speech cues, and so when we're projecting our voice, the sound has to go either around the mask or through the mask, and so that's going to attenuate or reduce the sound. Depending on the different masks, it can do that to varying degrees. So best case scenario, we're talking about some of the paper masks or disposable surgical masks. And so those are going to reduce the higher frequencies or high pitches by about 5 decibels. And that might not sound like a lot, but it's quite meaningful. And as you change mask material, so maybe you look toward to maybe heavier fabric material or something like an N95 mask, that doubles. And so we're looking at high frequencies diminished by about 10 decibels. And then if you go all the way to something like a splash guard or a visor, that's the most severe impact. And so we're looking at about 20 decibels. Because it's a logarithmic scale, that's more than just doubling. It's quite a significant impact. That brings us to the second impact, which is where it's impacting things. It's impacting things in the higher pitches or high frequencies, and that's doubly a problem. It's a problem because most people with a hearing loss or hearing impairment are suffering a hearing loss in those high pitches, and so it's sort of doubling the area where they already have an issue. And if we think of the sounds that we produce in those high pitches or high frequencies, they tend to be sounds we call fricatives or sibilants. And so those are the sounds that we produce with our tongue or our teeth. They're things like S's and THs and Fs. And because of the way we're producing those sounds, those are actually very soft sounds to begin with. And so when you reduce them with the mask, it's having a pretty big impact. And then we're hearing them in an area where we often already have the most amount of hearing impairment. It's hitting us all that much more severely. And then that brings us to the third factor, which you already mentioned, is when we're not hearing these auditory cues, the S's or the THs that might separate one word from another. What our brain does is it tries to compensate, and it's going to use anything it can, our knowledge of the language or the subject or context or whatever. And one of the big things that it looks for is visual cues. And so wearing a mask obviously is going to rob us of those visual cues that might have told us the difference between one speech sound or another.
That's right. And I mean, another element of making it harder to hear people too is businesses and doctors' offices, they've got an extra layer of plexiglass in front of you too. So now you've got a mask on and you've got a plexiglass barrier between you and the person you're trying to communicate with sometime when you're out in the community.
Absolutely. And that plexiglass barrier is going to have a pretty significant impact, similar to the splash guard. It's really going to deflect sound and distort it, and that can be really problematic.
That's right. That's right. So I've got a good friend. We have a friend here at FYI, Rhonda Smith, and she's deaf, and she's had some concerns, and she puts. I've talked to her about it. She's deaf, and she just when you go out into the community, she knows when people are frustrated or with her because she can't hear very well too. So maybe you can speak a little bit about how if somebody does have a hearing impairment or is deaf, like there's got to be different ways to be able to communicate with people while you're wearing a mask.
Absolutely, and the frustrations that people are encountering shouldn't be minimized. I mean, the pandemic has been in a time of increased stress and anxiety for a lot of people, and so adding this additional stressor is really something we want to avoid. And so there's a number of strategies we can do. One of the ones that isn't necessarily on people's mind is considering a different mask type. And so there's clear mask types, something along these lines that are an option. The way something like this works is it's just offering a clear pane so you can preserve visual cues. And so that's definitely an option for a lot of people. Is it perfect? No, I mean, it's not a perfect solution, but anything we can do to facilitate, I think is worthwhile. And so there's a number of mask types similar to this that are available. And that's one thing that I would recommend, and we're using those in a number of our clinics as well. The other thing is, being really conscious about our communication. Communication is something that is just, we take it for granted. We use it every day, and so we don't really think about it. And when communication breaks down, I think it can catch people off guard. And one of the important things is being more present in our conversations. One of the things that I would recommend people is, when we're trying to have a conversation with somebody, still try and maintain that eye contact and make sure we actually have their attention, because that's signaling a lot of cues that, we're talking to one another, and that provides the brain with increased attention, and so it can redirect energy and focus, and that's going to make a big difference in terms of communication. Another big one I like to mention to people, because they're not always thinking about it, their instinct for many people is to just raise their voice and maybe shout or speak louder, and it's not always helpful. In fact, it can even be detrimental, because we're straining our vocal cords and we're changing the quality of how we produce sounds when we do that. Instead, repeating is appropriate, or better than even just repeating is rephrasing, because as I mentioned earlier, what our brain is doing is it's going to look for other bits of information that are part of speech. And when we rephrase, we're providing the brain with more information to sort of sort through the mess of what it's trying to figure out, and it can more likely arrive at the conclusion. So rephrasing can make a big difference as well.
That's right. And I mean, even people who are lip reading, they're not getting every exact word that you're saying. They're trying to get, what is the subject? What are we talking about? And go from there too. So yeah, not always speaking louder. It's speaking clearer and with clarity.
Definitely. And in addition to speaking more clearly, slowing down helps a lot. So when we slow down our speech and we enunciate a little bit better, that's giving the brain a lot more time to process. And so again, it has more to work with, and it's more likely it's going to piece things together, even if it's dealing with limited information.
Yeah, and I mean, we're lucky right now too with technology. There's different ways we can communicate. People can communicate on their phones, even the old-fashioned way, write it down.
Absolutely, and so we've seen that many times, both in clinic and out in the field. People will resort to writing things down on a pad, but there's lots of apps right now that do things like speech to text, and so you can very close to real time be using a speech to text app and present that to someone, and that can make a huge difference in bridging a communication breakdown.
That's right, and you said to me in your email too, confirm your conversation, confirm you were clear too, just to make sure you're getting the conversation correct.
Absolutely. I mean, there's lots of instances where people are smiling and nodding to go along with the social flow. It's embarrassing sometimes for people to have communication breakdown, and they might still be processing and thinking, and so going back and making sure that that communication's actually happened, that we've been clearly understood, is definitely a good idea.
Okay, so I'm going to squirrel a little bit here, Andreas, because and this is an area of interest to me. I know we haven't talked about this, but I'm sure you probably got some answers for this. I know some people who have hearing aids and wearing a mask, and I know sometimes they've taken them off, they've gotten tangled up. Hearing aids have come a long way, and some of them don't do the wraparound anymore, but have you got any advice for people who wear hearing aids and wearing a mask?
So it's a very common concern. I'm glad you brought it up. Some of the most popular designs of hearing aids still use a very thin wire and then still wrap around the ear, and it's a very successful design. Problem with masks now is that they're going and they're interfering often with where the hearing aid is sitting on the ear. Two things. So the mask that I was using, actually, the way it goes around the head is it's going around the back, and so it's not actually wrapping around the ear. And so there's a number of mask designs that you can look at that tie up around the back of the head as opposed to interacting behind the ear. So that's one solution. We have ear savers in our clinics as well. And so ear savers, what they do is they redirect the cord that's typically sitting behind the ear, and they bring it back. And the original intention behind those ear savers was, to prevent chafing behind the ear and the discomfort of wearing a mask all day. But for hearing aid wearers, it also does the same thing. It's pulling the strings and straps away from the ear. And so you're reducing the risk of interfering. There's lots of designs that don't go behind the ear. So we have custom in the ear hearing aids, and even having a custom molded tip might reduce the risk that it actually comes off because it's molded, and so the retention in the ear is a little bit better. But being conscious when we're putting on, taking off a mask, and even going a step further, such as using ear savers or a different design that's not going to interact with the behind the ear is going to be your best bet.
Those are all very good points, very good points. I like that mask that you have there too. Are those available to the people, like the public?
The one I particularly had here is, it's called the Clear Mask. It is something that you have to get from the United States, and so it is an option for people, particularly if they're willing to get a batch of them. We have in our clinics a different type of mask that it has a clear pane, and those are available to people that are interested in purchasing them. Those are individually wrapped, and so they're a little bit better for resale. People who've had a hard time sourcing masks like this because they've gotten some attention, but they're just not as prevalent yet. A number of people have also gone to people who are manufacturing them out of fabric. And that's worked for a number of people as well, to go to, whether it's a local tailor or someone that's repurposed some of their business towards making masks and having them construct something clear painted.
Excellent, excellent. The numbers of people who have hearing disabilities too, it's pretty phenomenal. The number I got from you, I believe there's 1 million in Canada have hearing issues. But there's more people out there that haven't sought any help yet, and they still suffer from hearing disabilities as well too. So when we're wearing masks, there's so many people out there that are already trying, and there's some people that haven't really accepted the fact and gotten help yet, I guess is what I'm trying to say, Andreas.
A publication in Canada just last year was addressing the idea of unperceived hearing loss, and how there's a large majority of individuals who have an underlying hearing loss and probably just don't know it, because the onset of hearing loss tends to be so gradual that we don't notice the day-to-day changes. And so we're so good at coping and finding ways to compensate that, kind of push it off for a while. And I'd like to think of the pandemic as a little bit of a silver lining, that it can be the canary in the coal mine to tip people off. And so if people find that they're struggling during this time with things like reduced facial cues and mask wearing, that might be the clue that there's something else going on. And so it might be a nice call to action for people to investigate. I mean, it doesn't hurt to have your hearing checked, and it's better for us to know. So I'd like to think that this can be a call to action for people to investigate, because all the studies show us that, if we intervene early and we do something earlier about our hearing problems, the outcomes are much better in terms of our health, reducing risks of things like cognitive decline, and even our success with hearing aids is much better when we do something earlier than if we push it off. So I'd like to think that there's a little bit of a benefit, at least, out of all this pain that's going on.
And last time we talked too, you made mention, we go get our eyes tested every year or two. We go for physicals every year. We should be getting our hearing tested.
Absolutely. I mean, you're preaching to the converted here, but I mean, if people aren't afraid to go get their teeth checked on a regular basis, why should we feel any differently about something like our hearing, when in reality, it's really what connects us to everybody around us. And for something that's so vital for our well-being and our day-to-day interactions, if we could be hearing at our best, why would we want that for ourselves?
That's right. That's right. Well, thank you very much for reaching out to us again, Andreas, because, again, I could talk about this forever. But is there anything you'd like to add before we wrap up?
No, I just reinforce that call to action. Come into one of our Hearing Solutions clinics and have your hearing checked. It's a painless process. I would say if people don't get anything else out of this, then I think that would be the most meaningful thing.
How would people get a hold of you?
Best place is online. HearingSolutions.ca is the best place to reach us.
Excellent, excellent. Well, thank you very much for joining us again, Andreas Seelisch. He's a director of audiology at Hearing Solutions, to talk to us more about people that have hearing issues and wearing a mask and getting us through this pandemic. Thanks for joining us, Andreas.